Bekesy Audiometry. Bekesy Audiometry is an automatic method of measuring audiometric threshold. In this, the patient is being tested needs to hold down the response button when the tone is heard and release when no longer heard. Frequency Bekesy Audiometry. In this, the patient tracks his threshold for a range of frequency from 100 to 10,000, whereas in fixed frequency Bekesy Audiometry, the patient tracks his threshold at one frequency. Given table depicts the interpretation of Bekesy audiometry obtained in pulsed and continuous tracking. In type 1 Bekesy audiometry, the pulsed and continuous tone tracing are interwoven, which is normally seen in normal hearing or a conductive hearing loss. 2 is often seen in cochlear impairs, where the pulsed and continuous tone tracing are interwoven up to 1 kHz, and at high frequency the continuous falling behind the pulse less than 20 dB and runs parallel later. 3 is often seen in retrocochlear pathologies, where the continuous tracking diverts very quickly from the pulse tracing and shifting to the audiometric limits. In type 4, the continuous tracking falls more quickly, more than 20 dB below the pulse, and runs parallel. This is often seen in cochlear or retrocochlear pathologies, most often retrocochlear pathologies. In type 5, the pulsed tracking falls below the continuous, which is seen in function hearing loss, that is non-organic hearing loss. Moving on to forward-backward Bekesy audiometry. The forward-backward Bekesy audiometry includes tracking of frequency sweep from high to low, that is backward, and low to high, forward. Forward and backward Bekesy audiometry is interpreted by considering forward and backward discrepancy. Large forward and backward discrepancies are associated with retrocochlear pathology. In the given diagram, the first one has no discrepancy, indicating normal hearing. In the second one, there is a greater discrepancy in forward and backward tracking at higher frequency, hence indicating retrocochlear pathology. Moving on to Bekesy comfortable loudness testing. Bekesy comfortable loudness testing is similar to sweep frequency audiometry. The only difference is the patient is asked to release the response button at the comfortable level. Bekesy comfortable loudness has 6 configuration, which is broadly categorized into negative and positive. Negative is associated with normal hearing, conductive hearing loss, and cochlear impairment, whereas positive for retrocochlear pathologies. The given table depicts the 6 configuration of the Bekesy comfortable loudness. The first 3 depicts the negative configurations, and the second 3 depicts the positive configurations. These are the schematic representation of the Bekesy comfortable loudness configuration. The right side depicts the negative configurations, and the left side depicts the positive configurations. For more practical understanding, let's see a case report. This is a case report of a 57-year-old woman with mild sensory neural hearing loss in the right ear due to meningioma in cerebellopontine angle. This is the Bekesy audiometry figure of the above given case, where they have 3 tracing given, that is preoperative tracing, postoperative tracing within intervals of 2 months and 9 months. As you can see, the preoperative Bekesy pattern is of type 4, and in preoperative Bekesy pattern you can see a greater discrepancy in backward and forward Bekesy, and later the last two indicates the postoperative Bekesy, where you can see the discrepancy becomes smaller in the postoperative courses. These are my references. Thank you for your patient listening.